February is National Pet Dental Health Month. With me this noon is Dr. David Liss from Goodheart Animal Health Center. Thank you so much for being with me today.
Yeah, thank you for having me.
Okay, we're talking about dental health because that is the #1 thing that we've been focusing on for the month of January with our pups. Talk to me a little bit about, if we get a dog from puppyhood, what we can be doing to keep their teeth up throughout their life.
Sure, yeah. So there's a lot of things that we can be doing. I always like to break it into what you can be doing at home,
Okay.
and then what we do at the office.
Yeah.
And so it starts with what you all can be doing. Really the best thing you can do is brushing.
Okay.
As close to daily as feasible.
Daily.
Yeah.
None of us do that. I'm a
And
bad
so,
pet owner.
Yeah, definitely easier said than done, but
Yeah.
if they allow it, that really is the best thing you can do.
Okay.
And then there certainly are some easier, more hands-off products. So things like treats or
Okay.
food or water additives to consider as well. In general, if we're using those, I recommend looking for products with a VOHC logo, Veterinary Oral
Okay.
Health Console.
Okay.
They just tend to have a little bit more data and research behind them.
That was going to be my question, because you see a lot of things branded like a little bone for good for their teeth health, but is it really? And you're telling me that's the qualifier to look for.
Yeah, there's so many products out there, so I like to use them as kind of a standard on some that have a little bit more data behind them.
That's really helpful. Now, what if we're looking at our pup? I know I adopted mine, so I don't know what their care was like in the early days, and I'm like, things are looking a little questionable. What should I bring them in? What should I be asking for?
Yes, I think all dogs, or pets rather, regardless of their history, can benefit from an annual dental exam.
Okay.
So, just going in for that yearly checkup is a great starting point. Really should be part of any annual thorough exam, and it really is an important focus.
Yeah. Okay, so if they do need this procedure, I know depending on when they go in, if they're going under, right? Like it might be more complicated, it might not. Can you explain a little bit about what that looks like if they do get the dental cleaning?
Of course. So generally it is very similar to when we go to the dentist for a dental cleaning, with the pretty notable exception that they do need to be under anesthesia. Yeah. It would be great if they could sit still and spit in a cup for us.
That'd be asking a lot, Dr. Liss, huh?
Yeah, not the case. And so we do need to put them under anesthesia, put in a breathing tube to protect their airway.
Okay.
And then usually we're in teams of 2 to 3,
Wow.
splitting up cleaning, scaling, polishing, monitoring anesthesia, and grabbing instruments as needed, and on occasion performing extractions as needed. The whole process for a good thorough cleaning can take anywhere from 45 minutes to an hour, hour and a half, depending on the size of the animal and how bad that dental disease is. And then afterwards, usually hour or 2 of recovery, and they wake up feeling pretty good.
My elderly Chihuahua, who's no longer with us, had to get this, and he had to have some extraction, so I know it made the cost go up. Talk about how that can kind of vary for us, if they need extractions or not.
Yeah, absolutely. So extractions can certainly extend both the time and the cost of those procedures. Certainly a lot more involved in those cases. So yeah, certainly have had my fair share of cases with a large handful of extractions. Really the best way that we can hope to avoid that is going for those annual check-ins, and ideally as close to annual cleanings as we're able to prevent it from getting to that point.
Fantastic. Well, we can't thank you enough for joining us today, Dr. Liss. We appreciate it. I know you've got a busy day.
Oh yeah, thanks for having me.